Hi, my name's Toria Moore. I work at Eastern Families Project. I'm a representative on the Bristol Children and Families Board. We last met on the 17th of September and we started with a presentation from Public Health about their work in the city, particularly the Children's Community Health Services and their consultation that they're running at the moment. If you want to do that, it runs from now until the 25th of November. And it would be good for you to say what you think of their new plan for children, communities, health services. The main concerns in public health at the moment around children and families are childhood obesity, dental care and social and emotional well-being. So those are things that there is work on at the moment. Secondly, we looked at the purpose and the priorities of the Bristol Children and Families Board, and there was a name change. It's now become the Bristol Children and Families Partnership Board. The work plan is being revised, and as advocates we've been asked to have a look to see where the voluntary sector can input into that work plan. We looked at the terms of reference for the board and recognised the wide benefits of early intervention and prevention, and that will be prioritised across the city. The working principles of the board include the support of the prevention and early intervention, to prioritise outcomes for vulnerable children, to take an evidence-based approach to the planning, and to listen to the voices of children, young people and their carers, and to be open and honest in the response to them. We will also ensure that all commissioning decisions make the most effective use of collective resources. We looked at the data that was given to the Children and Families Board and how that fits with other data that is given to other strategic groups. The next on the agenda was corporate parenting strategy. Corporate parenting is our collective responsibility to ensure the best outcomes for children in care of Bristol City Council and care leavers. We noted that we need to care about children as well as for them. There is a concern at the moment that Bristol have a high percentage of NEET, not in education, employment or training, care leavers, and that our percentage is higher than the other 8 core cities. The objectives of the corporate parenting plan are for children to live safely with their families if possible, and if children are need to go into care, to look for the extended family for support first before children are placed in the care of Bristol City Council. If children are in care, we need to ensure that their placements are enriching experiences and that they are good quality placements. We also want to make sure that we close the attainment gap for children in care, and we want to improve outcomes for children when they become care leavers. The fourth item on the agenda was a presentation about early intervention in Bristol, based on a report from the Early Intervention Foundation in June 2015. Early intervention matters because of the significant spend on failure demand and acute services when families are in crisis. It also matters because it fails families not to offer help when problems first arise. Recommendations from the report included early intervention as a core theme for the resilience programme, and for joint training across Bristol on making every contact with families count. Also suggested there should be better joint working between troubled families and housing. Lastly, there'll be a Think Family conference on the 26th of November from 9:30 till 4 o'clock, and that will help to develop thinking around the Think Family approach and to reflect on the need for early action. If you'd like to go to that and you don't know about it, please contact ASMA. My contact details are on the VOSCA website if you've got any questions about any of that.